Thanks very much to the OtoNotes team for inviting me to give this episode of the OtoNotes High Yield Series. This is going to be on the topic of otosclerosis. My name's Joe Manjaly. I'm a consultant otologist and hearing implant surgeon based in London in the United Kingdom. So the first thing about otosclerosis is that it is easily missed, and that is because when you look on otoscopy, the appearances are typically normal. And so to clinch the diagnosis of otosclerosis, you're going to need to think about it. When an adult presents to you with adult onset progressive hearing loss, either in one ear or both ears, their otoscopy is normal, and then crucially, there is an air bone gap, i.e. a conductive component to their hearing loss on the audiogram. With normal tympanometry, one should be thinking that this is otosclerosis until proven otherwise. To back up the diagnosis, you can then use tuning forks, and your Weber should lateralize to the more affected ear, and your RINI testing should be negative, i.e. the patient should hear bone conduction louder than air conduction, and many surgeons then use CT scanning to confirm the presence of otospongiosis at the fissula antifenestrum. Essentially, our ears have a conduction system connected to a microphonic system, and otosclerosis can affect both, so it can cause either a conductive or a mixed hearing loss. The most pertinent point being that you get bony remodeling, particularly around the footplate of the stapes, leading to fixation of that bone and reduced conduction of sound. It tends to run in families, so the patient may have a family history, but not always. And it's also worth acknowledging and identifying with the patient the functional downstream consequences of hearing loss, be that with bilateral, which presents as increased listening effort and general difficulties, as well as the impact of unilateral hearing loss, which more specifically starts to affect sound localization, daily listening effort, and managing conversations in noisy environments. Getting to know the patient and establishing their particular difficulties very much helps with understanding which management options might be appropriate. So you may also want to understand what they do for work, how much their daily living involves noisy environments versus quiet environments. Broadly speaking, there are 4 management options in this scenario. Option 1 being conservative management and doing nothing more than making lifestyle adjustments and helping people in their life to communicate more clearly to overcome those listening challenges. Option 2 being the use of a conventional hearing aid to boost the amount of sound going into the inner ear. Option 3 being the option of stapes surgery, and option 4 the use of bone conduction devices and implants. Looking more closely at stapes surgery. So this is done either under sedation or a general anaesthetic, and it involves raising a tympanomeatal flap to explore the middle ear and confirm stapes fixation. The next step is to then divide the joint between the incus and the stapes, and nowadays most people will use a laser to remove the arch of the stapes, leaving just the footplate and the incus. One then makes a fenestration through the stapes footplate and then uses a stapes prosthesis to connect the incus through the fenestration of the stapes, therefore restoring conduction of sound and aiming to close that air bone gap on the audiogram that we initially saw. Stapes surgery, unlike using devices, aims to restore authentic unaided hearing, and so has some great benefits in that respect. But careful counselling is needed. There are some risks associated with it that a patient needs to understand very carefully, particularly the risk of complete sensory neural hearing loss. However well the surgery is done, there will be a small proportion of patients whose inner ear reacts badly following the surgery, and so this needs to be carefully considered when weighing up the options. That's a very quick run through, but you'll find more videos and information on stapes surgery on my page.
Thanks for listening to OtoNotes High Yield Series. Remember to like and follow for more on the Go ENT education.